Good afternoon, everyone. Bon après-midi à tous. Today, there are 454 new cases of COVID-19 in Ontario. There are 243 people in hospital and 136 in our intensive care units due to COVID-related critical illness. And I am sorry to say that about another 9 deaths have been reported. A total of 33,364 tests were processed yesterday with a positivity rate of 1.8%. As far back as July, I spoke about an anticipated rise in cases as we move towards the fall and winter. We are now seeing this occur in some parts of Ontario. As the temperature begins to drop and more people move indoors, we can expect to see cases fluctuate or continue to increase over the coming months. While this is not cause for alarm, it will require continued vigilance from each of us, and we must stay cautious and disciplined in the face of this virus. Provided we follow public health measures and increase our vaccination rates, we can continue to manage transmission of the virus at a local level and minimize the impact on our hospitals and intensive care units. Tant que nous respectons les mesures de santé publique et que les taux de vaccination augmenteront, nous pourrons continuer à gérer la transmission du virus au niveau local et minimiser les impacts sur nos hôpitaux et nos unités de soins intensif. The transmission we are currently seeing is predominantly among the younger age groups and the unvaccinated. And while the younger age groups are typically less likely to suffer severe outcomes from COVID-19, the virus still has the potential to cause serious illness and hospitalization. If someone is infected, even with mild symptoms, they can still transmit the virus to others who may become more vulnerable. This virus is not going away. There's no way of escaping it. So if you are not vaccinated, you are susceptible and at increased risk of serious illness and significant outcomes associated with COVID-19. We have safe and effective vaccines to protect yourself, your community, and your loved ones. And getting vaccinated will help us to recover much more quickly as a population by having the highest immunization rate we can achieve as a province. And if you are just starting your vaccine series, the National Advisory Committee on Immunization recommends an optimal interval of 8 weeks between first and second doses of a 2-dose COVID-19 vaccine series. Individuals who wish to get their second dose at a shorter interval, as applicable, can continue to do so, but with informed consent. And I want to say thank you to everyone who has been vaccinated. Currently, 88.5% of eligible Ontarians have 1 dose, and 85.2% have 2 doses of a COVID-19 vaccine. In regards to booster doses, I also want to thank the eligible Ontarians who have already come forward to increase their protection against COVID-19 by receiving their 3rd dose or booster dose. While a primary series of COVID-19 vaccine has shown to maintain high vaccine effectiveness and is providing powerful and persistent protection following the 2nd dose, emerging evidence suggests vaccine effectiveness against symptomatic infection and mild illness may decrease over time, and a booster dose could help restore and maintain the protection against infection. Particularly important are 3rd doses for individuals who are immunocompromised, such as transplant recipients, cancer patients, and individuals taking immunosuppressant medications. A 3rd dose completes their series to provide the best possible protection. With cases increasing and more of the virus circulating, I am strongly encouraging the many eligible Ontarians who have yet received their booster dose to consider doing so to ensure they get that extra layer of protection against COVID-19, including the Delta variant, as we head indoors. Le nombre de cas étant et la hausse et plus de virus étant en circulation, j'encourage fortement les nombres ontariens et ontariennes admissibles qui ne l'ont pas encore fait de recevoir leur dose de rappel bientôt pour s'assurer de bénéficier d'une protection supplémentaire contre la COVID-19, incluant le variant Delta. And because Ontario is seeing an increase in some of its key indicators, including the effective reproductive number, the percent of tests that are positive, and our weekly case rates, and out of an abundance of caution, we are pausing the next step of the plan to reopen Ontario and manage COVID-19 for the long term. This means that the planned lifting of capacity limits in remaining settings where proof of vaccination is required will not be moving ahead on November 15th. Et parce que certains des indicateurs clés de l'Ontario sont à la hausse, y compris le taux de reproduction nette, le pourcentage de tests positifs et le haut hebdomadaire de cas, nous interrompons l'étape suivante du plan pour un déconfinement prudent en Ontario et le contrôle à long terme de la COVID-19 par excès de prudence. Cela signifie que la levée des limites de capacité dans les environnements qui restaient où une preuve de vaccination était requise ne se fera pas tel que prévu le 15 novembre. We will remain vigilant and continue to monitor trends, and we will evaluate in 28 days if it is safe to move forward. We have taken a cautious approach to reopening the province, and the plan was always designed to be guided by the ongoing assessment and monitoring of key public health and healthcare indicators to ensure that public health and workplace safety measures are lifted safely. Ontario has continued to make progress as a result of its safe and cautious approach to reopening. We continue to have one of the lowest weekly case rates in the country, and our hospital intensive care capacity is currently stable. But to ensure that we maintain our progress, it is necessary to make this deliberate pause. We must remain vigilant. And we must continue with key public health strategies that have been effective in keeping this pandemic under control. Continue to stay home when sick. Get tested if you have symptoms. Wash your hands. Wear a mask. And above all, please get vaccinated. Thank you. Merci.
We'll go to the phone lines for questions. Just a reminder, one question, one follow-up. Over to the first question, please.
From Rob Ferguson at the Toronto Star.
Hi, Doctor. Since you're pausing the next step of the reopening, I'm wondering what you would say right now, given the trend of rising 7-day average for 11 days, what you think this bodes for the plan we heard a couple of weeks ago to perhaps start lifting vaccine certificates in January and the other restrictions that were going to be lifted until the end of March.
Thanks very much, Rob. So I think Ontarians should take assurance that this government will follow data. Given the rise in case counts in the province, that we are making a data-driven decision-making process. So at January 15th, that week, it was our goal to reassess the data and make a decision at that time about continuing verification in certain environments. So I will assure all Ontarians we will continue to advise the government using best data and analysis of the risk for Ontarians at the time, that the plan will continue to be on the second week of January to reassess the data, so that will reflect the holiday season, the return to school, colleges and universities, and at that time make any further determination on further removal of public health measures. But please, it will be driven by the data and the analysis. Our goal through this pandemic has been to limit the effect on our hospital sector, to limit the number of people that are ill requiring hospitalization or intensive care use. I am happy at present with the trends that we have, limiting the impact on our healthcare system, but we have to maintain those for the coming weeks and months.
Follow-up.
Thanks for that, Doctor. And just in regards to some of the health units that are seeing rapid rises in cases. I know, and I'm not trying to be alarmist, but Sudbury, Southwestern Ontario, Haldimand, Norfolk, Kingston, Simcoe, Muskoka, and Niagara, they're all seeing fairly rapid increases in cases. For example, in Simcoe, Muskoka, they're up 80% in the last 2 weeks. Others not quite as much, but they're all in what would previously, in the pre-vaccination area, have been lockdown or severe restriction territory. Now, I know we're not in that kind of environment anymore, but what is driving these some of them exponential rates of increase? Are they like clusters of people here and there? Do you know where some of the most frequent types of outbreak locations are? That I'm looking for that kind of detail.
Great question, and thank you so much. So you're right. We're seeing some rapid exponential growth in some areas of the province, and I want to assure Ontarians that the local medical officers of health are doing the right things. I applaud what Sudbury has done through the Sudbury District Health Unit and Dr. Penny Sutcliffe. I think it was appropriate that they hold back the limits on capacity for some venues and ensure appropriate use of the verification process for other venues. That is prudent, it's responsive. It's been our plan since the summer to respond to the threat of this virus at a local level. The virus is a formidable foe. It wants to spread very quickly and rapidly and will do so in pockets of populations that are unvaccinated. And that's what we're seeing across the province, is that in areas of the province that have had previous low levels of infection, where the population had perhaps low immune protection through vaccination or natural infection, that this virus will spread. It will continue to do so until we have a very high level of vaccination and, or quite frankly, till we have more people sadly infected and put at risk by this virus. So our goal from a public health perspective has always been to have the highest level of vaccination that we can, and now to encourage the third dose protection as we go into winter to maximize that long-term protection, especially for those that are the most vulnerable to this virus, those that are over 70 years of age in our long-term care sectors, our retirement homes. What's really good news for Ontarians is that our plan is working, that in those environments, our long-term care facilities remain highly protected. The third dose strategy is protecting those that are living in those environments. The vaccination level of the workers continues to increase under the leadership of the minister and his directives. They, as a result, have had fewer and fewer infected patients, clients of those facilities, as well as workers. So we have learned from that strategy. We're also minimizing the impact on our acute care sector in most of these environments. We're always watching the admission rate in Sudbury and Simcoe and Southwest, and whether they have hospital capacity. That's key to us. But sadly, it's spreading mostly from the 20 to 39-year-old age group. It's mostly in social settings where we take off our mask, where we have close contact as we move indoors in closed spaces, and that's where most of the transmission is occurring. Our schools remain very safe across the province. Our secondary schools especially have had low rates of transmission, and I'm very happy with the high uptake of vaccination that I can only encourage ongoing uptake amongst the 12 to 17-year-old age group. And as we go forward to have vaccination for 5 to 11s, I think our elementary schools will even be further protected. So we're in regular contact with these health units that have fast and furious spread. We're providing consultation to them. They are doing the right things to protect their community. And this is going to be a battle in those areas where we have a combination of low vaccination and or previous low population immunity to the virus.
Next question.
From Adrienne Gabriel at CTTV.
Hi, Dr. Moore. This week's City News has been going to some Toronto area restaurants to see if they are following along with the vaccine certificate mandate, if they're scanning QR codes, if they're checking people's vaccine certificates. We found that multiple restaurants, some smaller independent ones as well as some large chains, aren't following through. And they're either not scanning the QR code, they're not asking for ID. Some places aren't asking for anything. When you hear that, you see the cases are rising. What is your concern?
Well, I'm disconcerted to hear that. I am, though, thankful that the vast majority of businesses have adopted the verification process. They're following the procedures appropriately and safely, and that the vast majority of Ontarians are showing their certificates, and those venues are remaining very safe. It is a plan that we've always had from the enforcement vantage point to have progressive enforcement. So we started September 22nd with education. We moved to the QR code on October 22nd. And now that you've had the opportunity to use the electronic scanner and QR code, you can anticipate that there'll be progressive enforcement. And the provincial offences officers that are enabled under the Reopening of Ontario Act to enforce compliance will be out, not just educating anymore, but also enforcing. And I want to remind businesses, even though I want to thank the vast majority of them exceptionally compliant, that there are fines associated with non-compliance. And they can be significant, from $1,000 all the way through to $10 million of a corporate fine. So this is serious. As we head indoors, we'll need more and more progressive enforcement, not just education. We will treat this very seriously going forward, especially if our rates go up and or we see transmission in those areas where they should have had verification process. We don't want vaccinated and unvaccinated populations mixing and transmitting the virus as we go indoors.
Follow-up?
Thanks for that, Dr. Moore. One other story City News has been working on this week is that we've confirmed that some individuals attending Leaf and Raptors games have been using counterfeit vaccine certificates to enter the arena. Mainly they are using the old vaccine certificate. They're doctoring the name, forging the name on the old vaccine certificate and using it. Would it be your recommendation to the provincial government to finally phase out the old vaccine certificate now that we've had the QR code system up and running for several weeks and it's nearly impossible to tamper with?
Well, thank you so much for that question. Again, I would thank the vast majority of Ontarians are following the rules. The vast majority of businesses are adhering to screening to protect individuals as they go indoors to these venues. There always will be exceptions to the rule. I'm saddened to hear of fraud occurring. I do believe it's a very small proportion of individuals that would commit this fraud. If we continue to hear or see transmission in these settings, it has to be because unvaccinated or are mixing with vaccinated individuals. And as a result, I would make a recommendation to government, if we continue to see evidence of this, to move to the QR code as the means of verifying vaccination status. I think that's prudent, and it also aligns with our progressive enforcement and progressive education of the public, especially for large venues where we don't want to see transmission or risk. And we want to make sure that they remain safe for all Ontarians so we can keep our rates low. So it will be one area that we will review and make recommendations to government on and collect further evidence as you are collecting it.
Next question.
From Laura Stone at the Globe and Mail.
Oh, hi, Dr. Moore. We've heard you repeatedly say, don't panic. Cases are going to rise as the colder weather comes on. But I think there are some people who are looking at the numbers now and getting alarmed. So what do you say to those voices, some of them in the medical community, that are looking at these numbers and calling on the government to do more? How do you explain why you're not making any significant changes today?
Well, thanks very much, Laura. So we are putting a pause on further reopening and keeping the current capacity limits in those venues that were supposed to open on the 15th of November. Also, we have to realize we've made so many important steps and changes in the last year and a half of this pandemic. We have over 88% of our eligible Ontarians that have come forward and gotten vaccinated with their first dose, 85.3% with their second dose. Just finding, I think that's absolutely correct, 85.2% of people have had their second dose. And I hope by the end of this month to be able to announce further information on the 5 to 11 vaccine program, which will further protect transmission in school settings, in home settings, in multi-generational homes especially. As well, we anticipate having access to antiviral medications in the new year. You may have heard of several companies announcing oral outpatient medications. I think that's a significant change that could help us minimize the impact on our health sector, admissions to hospital, and use of the intensive care unit. So we have tools at our disposal now that we haven't had before. Ontarians are still embracing the basic tenets of prevention. We're masking in public venues. We are still at around 30,000 a day getting tested for COVID, isolating if we have identified COVID, and quarantining of those contacts. And public health units are still following up at over 90% within 24 hours, well over 90%, and contacts well over 85% within 48 hours. So the system that we've put in place, the capacity for lab testing, the capacity for public health follow-up, plus the addition of 5 to 11 vaccine that should be coming at the end of this month, plus the addition of antivirals. These are all game changers for us in how we can limit the impact of this virus on our lives, and they're all going to be coming in the short term. Plus, Ontarians are still adhering to all the best practices. Unlike other places where they've taken on and then taken off and then had to put back in public health measures, we've remained constant, cautious, slow, and as a result, in the face of Delta as our dominant strain for many, many months, we have done well. I have to thank Ontarians for continuing to remain vigilant, continue to come forward to get vaccinated, and now with our third doses, we'll be even better protected. So yes, some people will look at the cup and say it's half empty. I'm saying it's half full, that we have systems in place to best protect Ontarians going forward, that yes, a caution and vigilance is required, but we're in a much better place than we've ever been before, with new tools at our disposal very soon.
Follow up?
Thank you. So do you think that the worst is over? Do you think that the restrictions that we have right now, save for the pausing that you just did on some of the, maybe the industries that aren't as utilized as others, I'll just put it that way. Do you think that this is it, it'll only get better from here on in, or do you think that we have the potential to roll back restrictions? And while I have you, I just wonder if you think that you may potentially open up eligibility for boosters to other groups faster.
Oh, so there was a series of questions. So number one, at a provincial level, I honestly don't see us stepping backwards. It's always been my advice to government that if we have to, we'll pause, but we won't take steps backwards. So I want Ontarians to hear my commitment that we'll keep our schools, our elementary schools open, our colleges, universities, secondary schools open, that we won't take a step backwards. We may have to, at a regional level, as we're doing and have worked with Sudbury District Health Unit to do, as we've done previously with Waterloo District and Porcupine District, when rates have gone too high too quickly. And if they need extra capacity for case and contact management, we have provincial resources to bring to bear. So I do believe at a provincial level, we are going to stay where we're at and not have to step back, that this battle against this fast, furious foe will be fought at a regional level, and we will provide regional supports to our local public health agencies who are doing tremendous work, immunizing as well as case and contact management, simultaneously protecting their communities, and a commitment to keep all of those major venues that we had to close in the past. Elementary schools, secondary schools, colleges, universities will stay open and will handle this at a local level. And I'm sorry, you may have had there were a lot of questions in that statement.
Next question.
From Lorenda Redikoff at CBC News.
Hi there. Thanks, Doctor. Given that it does sound like you're quite positive about things, is there anything that would tell you, okay, yes, it's time to change course?
Well, we have to anticipate that we will continue to see a rise in cases, and it's my hope that it will ebb and flow, and that we'll have capacity in public health and the health system to cope. An influx of returning travelers with high positivity and/or a new strain that the vaccine doesn't prevent against always keeps me up at night. So that's where we have to need international surveillance. We need some testing of returning travelers to understand what are the threats to Ontarians. We need to do whole genome sequencing on those cases if they're positive, to understand what strains they are and whether they could possibly elude the vaccine and or antivirals. So we don't see that on the international front just yet. But those are the major game changers that could happen, that could threaten our strategy at present, but we're not seeing them internationally and or nationally within the country. So I do believe we're in a good position. Slow and steady has done Ontario well. We must stay the course. I'm not saying stop washing your hands, stop wearing your mask. We should all be very conscious of limiting our social contacts, wearing our mask in public spaces. Please take advantage of the third dose strategy that we've unveiled for those that are particularly susceptible to this virus, which are the 70 and older, the First Nations, Inuit, Métis. Please, our healthcare workers, if and when the time is available to you for your third dose, take advantage of it as you are in the front lines, and we want to keep you as healthy and your families healthy as possible, as well as those that are immune suppressed or transplant patients. Take advantage of the third dose to best protect you and your families. All of those components and the rollout at a population strategy in the new year for third doses will only further protect us. And I do believe we're in a good place, but we all must remain vigilant.
Follow-up?
With that pause for reopening or lifting the capacity limits for nightclubs and other high-risk settings, first of all, if you could just clarify that 28 days, is that 28 days from now or 28 days from November 15th? And then also, there have been some outbreaks connected to nightclubs. Do you have concerns that maybe the current rules aren't being followed? And what's your message to whether it's club goers or the owners?
Yeah, so it would be 28 days from November 15th. We would reassess the data. So that'll, get us to around December 15th, where we'd reassess the risk of further opening them. We'll look at further capture of immunization. That gives us 28 days to further provide first or second doses to that population as well. If there have been outbreaks in those settings, and I think your intelligence is correct, we would have to look at how well the verification certification process is working in those venues, and we will be working with provincial offences officers to make sure that they're adhering to all the best practices to protect clients that are visiting and spending time in these venues. I am concerned as we go indoors. We know this virus likes low humidity, that it can stay in the air longer in those environments, that there is a risk of transmission, and hence the reason we need only vaccinated, protected people going into those venues to keep them safe. So we will continue to look at the progressive enforcement model of the verification process.
Last question.
From Nicole Thompson at the Canadian Press.
Nicole?
Please unmute.
Nicole, I think you're on mute. Okay, with that, we will conclude today's press conference. Thank you.